Okay, so the first thing I would do is I would walk into the patient's room and introduce myself, and I would make sure I have the right patient, right time, right medication, right dose, right route, and at the end I will document. The first thing we're going to do is I'm going to take an alcohol swab, clean the top of the vial for 5 to 10 seconds to make sure it's clean. And while that's drying, I will open up my needle. And I'm going to fill this up with 0.5 of air because the immunization calls for 0.5 milliliters of the influenza vaccine. Remove the cap, stick it up, in. I'm going to make sure that the needle is getting pull that out, cap on, flip away any bubbles. So here you can see I have 0.5 milliliters, no bubbles. Next I'm gonna open another alcohol swab. I'm gonna clean the skin. And for this immunization, we're gonna be using the deltoid. So how you find the site for injection for that is you put 3 fingers on the side, turn it 2, and then that's where you inject. So now I'm gonna put on hand sanitizer, put on my gloves, and I wouldn't do any of this until I have written consent from the patient. Okay, now I'm gonna remove the needle cap. I'm gonna hold the skin. Just go straight in, straight out, and I would close, and it goes in the sharps container. Now I would remove my gloves, put those away, and then perform hand hygiene. And then the next one that we're gonna do is the enoxaparin, and so this one calls for 40 milligrams, and this one goes in the abdominal area. So I open this, I'm going to clean my site with an alcohol swab. I'm gonna let that dry. While it's drying, I'll perform hand hygiene, put on my new set of gloves. And I'm going to remove the cap. Hold the skin, go right in, inject, come right out. And we're gonna push for the safety, goes right into the sharps container. And if there was any bleeding with the flu vaccination or with this one, you would just apply a Band-Aid. Next, I perform hand hygiene, and then I would document.